Happy February, which means happy Black History Month. Today, we're going to talk about the importance of self-advocacy. But before we do, go ahead and click the subscribe link below. Subscribe and share me with your friends. The importance of self-advocacy. Well, what does that mean? It means just that, advocating for yourself, speaking up when something is wrong, and making sure you understand what's going on. So I'm going to give you a couple quick points about how you can advocate for yourself to make sure you stay safe and navigate safely through this pregnancy and beyond. The first step in advocating for yourself is to make sure you choose a provider that you trust. And when you're choosing a provider, especially for something like your prenatal care, something so important as helping you bring a life into this world, I would go online, look at the providers that are in your area, and then based on providers in your area, then go to your insurance network and see who is in network. Then you're narrowing it down from the people that are in network and the people that are nearby. Go to their websites, Google them, look at their video, and see if their personality is something that you think you can relate to. If you like that provider's videos, go and look at their reviews. See what other people say about them. And I'm not talking about, oh, this person, front office assistant was rude, or this person had to run out into delivery. Those are things that can happen. You have to also understand that ratings are important, but people that have a bad experience, no matter what that experience are more likely to fill out a survey on a physician or a provider than those that don't. Okay. That's why if you see me and you like me, make sure you go and fill out your survey so that people can know you've had a good experience. But most patients that get bad news are more likely to go and vent online. Okay. For example, if somebody was told that their baby wasn't going to make it, regardless of the reason, even if it was the truth, that provider may get a bad survey because the last question on that survey is, how was your overall experience at the doctor's office today? Well, if you got bad news, your overall experience is not going to be good. So make sure you are keeping an objective mindset when it comes to reading these reviews, and then go through the reviews and see why exactly did this person have a bad situation. Could it be the front office personnel who probably isn't even there anymore, or was it really that doctor's bedside manner? Next, once you've chosen your provider, of course, you're going to schedule your visit or consult with them. Make sure you are writing down any questions you may have as they come to mind, even if it's before your visit, so that you can go in and go through your questions and get that provider to answer them. If you don't understand the answers that they're giving them, please take the time and say, can you please break that down for me a little bit further? Can you explain to me why you said I have to take this kind of medication? So ask questions. And if you're not getting the answers that you want, re-clarify and ask again. Last, if you just don't feel like you click with that provider, right? Or you don't understand your diagnosis, or you don't understand the treatment plan, ask more questions for true. But if you feel like you're not sure, like that doctor hasn't explained the situation in a manner that you can understand it, you can always ask for a second opinion or even switch providers. This is your body. This is your insurance, which means it's your money. You do not have to stay with a provider that doesn't get you and that you don't get them, or you feel like you're too rushed all the time. You should choose somebody that you can easily connect with. And sometimes people are having bad days. I get it. But if every time you go there, you feel like you're not getting anything out of the visit, you're not getting your questions answered, pick another provider. It's okay to reset and go through the process. But if you're pregnant in terms of prenatal care, it's better to do that in the beginning of the pregnancy rather than the end. In the end, there can be some insurance hangups where you're not going to be able to switch because some clinics do not accept people that transfer in the third trimester. Why? Because insurance is really confused in processing that, right? The insurance may pay the other people for your delivery instead of your new provider. So to prevent you from getting a ridiculous bill and having to go through a lot of heartache of getting money from one provider to another provider, or from one hospital system to another, which is something that hospital systems have to fight through, it's best to decide whether you want to stay with that provider after the first or second visit. And if you don't, that's okay. Go ahead, go through the process again, look at the videos online, see which providers that you like based on those videos, and then schedule a transfer visit with a new provider. All in all, we should not have to go in with a big list of questions, double checking our providers, right? We shouldn't have to do that. But in this day and age, in this political climate, unfortunately, where women's health is under attack, you really do have to advocate for yourself. Make sure you know what medical problems you have. Make sure you know what medicines you're taking. You have got to become literate in healthcare at this point in time. You need to keep a notebook with you, write things down, and ask questions. If you're out of town and you have to go to the emergency room, ask for a printout of your of what happened during that visit if you don't have online access to it, so that you can keep up with your own health and make sure you're keeping what happened at each visit in a binder on a notebook, so that you can go back and say, wait a minute, last month on this day we talked about X, Y, and Z. Is this still the plan, or has the plan changed? So that you can know and be aware of what's going on with your body, what's going on with your baby, and how plans change going forward. Ooh, and one more bonus tip. So if you're pregnant and you want help advocating for yourself, a doula is actually one of the best things you can do. If you're like, I have no healthcare background, or maybe you're a single mom, or maybe you're juggling working two jobs, or maybe you're younger, you're going to college, and you may feel alone in the doctor's office, get a doula. A lot of hospital systems have free doulas that you can sign up for, but even if you don't, there are a lot of doulas that you can hire. And some insurance companies do cover doula services depending on the state in which you're in. But that doula can be there to say, hey, remember we talked about X, Y, and Z? Why don't you ask the doctor about this? Or can even ask questions during the conversation to make sure that that information is clarified for you. So that is my bonus pearl. And I will have a doula on one of my Instagram lives coming soon. Thank you guys for listening to this quick episode of Pregnancy Pearls. Make sure that you take the time to advocate for yourself, which means being aware of what's going on with your health plan and with your pregnancy. Also, make sure to click the link below if you have not already done so. Subscribe, like, follow me on Instagram, follow me on Facebook, and share me with all of your friends. Until next week, bye-bye.